What does the term immediate use steam sterilization, IUSS, refer to? A. Long-term storage sterilization for future use. B. Cleaning, steam sterilizing, and delivering items for immediate patient use. C. Sterilizing single-use disposable devices. D. Chemical sterilization for heat-sensitive devices. Answer: B. Cleaning, steam sterilizing, and delivering items for immediate patient use. What was the previous name for immediate use steam sterilization, IUSS? A. Rapid sterilization. B. Emergency sterilization. C. Flash sterilization. D. Quick steam method. Answer: C. Flash sterilization. The main goal of point-of-use processing is to A. Shorten staff workload. B. Eliminate the need for sterilizers. C. Reduce the use of central service departments. D. Ensure items are safe for patient use. Answer: D. Ensure items are safe for patient use. According to AMI ST 79, IUSS can only be performed if A. Items are urgently needed and all required cleaning and cycle parameters are followed. B. It is more convenient for the staff. C. The sterilizer has extra capacity. D. The items are being sterilized for storage. Answer: A. Items are urgently needed and all required cleaning and cycle parameters are followed. Which organization changed the name Flash Sterilization to IUSS in 2009? A. CMS. B. AORN. C. Joint Commission. D. AAMI. Answer: D. AAMI. Which organization states that IUSS should be kept to a minimum and used only when there is no time for rapid sterilization? A. AORN. B. CMS. C. FDA. D. ANSI. Answer: A. AORN. What must be done to instruments before they can undergo IUSS? A. Quick rinse in water only. B. Proper cleaning and decontamination according to manufacturer's instructions. C. Immediate wrapping. D. No cleaning required if urgent. Answer: B. Proper cleaning and decontamination according to manufacturer's instructions. Which of the following is not allowed under CMS rules for IUSS? A. Sterilizing implants in emergencies. B. Using IUSS for heat-resistant instruments. C. Sterilizing single-use devices. D. Using physical and chemical monitors for every cycle. Answer: C. Sterilizing single-use devices. The Joint Commission requires documentation of each IUSS cycle to A. Track the device back to the patient. B. Reduce paperwork. C. Avoid repeating cycles. D. Allow instruments to be stored. Answer: A. Track the device back to the patient. What is terminal sterilization? A. Steam sterilization for immediate patient use. B. Process where instruments are sterilized in their final containers and stored until use. C. Chemical sterilization of heat-sensitive devices. D. Sterilization using only gravity cycles. Answer: B. Process where instruments are sterilized in their final containers and stored until use. Which of the following cycles is a type of IUSS cycle? A. Gravity displacement. B. Dry heat sterilization. C. Ethylene oxide. D. Hydrogen peroxide gas plasma. Answer: A. Gravity displacement. The minimum recommended exposure time for pre-vacuum IUSS of non-porous items at 270 degrees Fahrenheit 132 degrees Celsius is A. 2 minutes. B. 3 minutes. C. 4 minutes. D. 10 minutes. Answer: B. 3 minutes. Which type of containment device provides the best protection during transport after IUSS? A. Double-wrapped linen packs. B. Unwrapped trays. C. Sealed rigid containers approved for IUSS. D. Paper pouches. Answer, C. Sealed rigid containers approved for IUSS. Which type of monitor must be used at least weekly in IUSS sterilizers? A. Mechanical. B. Electrical. C. Physical. D. Biological. Answer, D. Biological. What is the risk if items are improperly cleaned before IUSS? A. Instruments may rust. B. Items cannot be sterilized effectively. C. Sterilizers may overheat. D. Transport becomes unsafe. Answer, B. Items cannot be sterilized effectively. Which of the following is part of proper PPE for decontamination during IUSS preparation? A. Gloves, mask, gown, and shoe covers. B. Gloves only. C. Lab coat only. D. Face shield only. Answer, A. Gloves, mask, gown, and shoe covers. According to CMS, each IUSS cycle must use A. Only chemical indicators. B. Only physical monitors. C. Physical, chemical, and biological monitors. D. No monitoring is needed if urgent. Answer, C. Physical, chemical, and biological monitors. Heat-sensitive medical devices at the point of use should be processed with A. Dry heat sterilization. B. Low-temperature disinfection or sterilization. C. Flash steam sterilization only. D. Boiling water. Answer, B. Low-temperature disinfection or sterilization. Staff performing IUSS must receive A. No training if supervised by nurses. B. Training once every 10 years. C. Training only during emergencies. D. Initial training, competency assessment, and continuing education. Answer, D. Initial training, competency assessment, and continuing education. Which of the following best describes the correct use of IUSS? A. To compensate for poor instrument inventory. B. As a routine sterilization method for all instruments. C. Only in urgent situations when no other sterilization method is possible. D. To sterilize items for long-term storage. Answer, C. Only in urgent situations when no other sterilization method is possible. Which statement best reflects the shift from flash sterilization to IUSS? A. From unwrapped, abbreviated cycles to contained devices offering better protection. B. From sealed containers to unwrapped items. C. From steam to dry heat only. D. From more use to central service only. Answer, A. From unwrapped, abbreviated cycles to contained devices offering better protection. According to AMI ST79, lumen items prepared for IUSS must be A. Wrapped in paper pouches only. B. Brushed and flushed under water with appropriate solutions. C. Sent uncleaned if urgently needed. D. Dried with compressed air only. Answer, B. Brushed and flushed under water with appropriate solutions. Which is an acceptable reason to run an IUSS cycle? A. Routine preference to save time. B. Lack of instrument inventory. C. Documented urgent need with no time for wrapped processing. D. To avoid using chemical indicators. Answer, C. Documented urgent need with no time for wrapped processing. Which sterilization cycles are considered dynamic air removal for IUSS? A. Gravity and dry heat. B. Dry heat and ozone. C. EO and hydrogen peroxide. D. Pre-vacuum and steam flush pressure pulse, SFPP. Answer, D. Pre-vacuum and steam flush pressure pulse, SFPP. Minimum exposure for gravity displacement IUSS of non-porous items only at 270 degrees Fahrenheit 132 degrees Celsius is A. 3 minutes. B. 4 minutes. C. 10 minutes. D. 1 minute. Answer, A. 3 minutes. Minimum exposure for gravity displacement IUSS of mixed non-porous/porous or lumen items at 270 degrees Fahrenheit 132 degrees Celsius is A. 3 minutes. B. 4 minutes. C. 10 minutes. D. 1 minute. Answer: C. 10 minutes. Minimum exposure for pre-vacuum IUSS of mixed non-porous/porous or lumen items at 270 degrees Fahrenheit 132 degrees Celsius is A. 3 minutes. B. 4 minutes. C. 10 minutes. D. 1 minute. Answer: B. 4 minutes. For SFPP IUSS of non-porous or mixed items at 270 degrees Fahrenheit 132 degrees Celsius, exposure time is typically A. As labeled by manufacturer, commonly 4 minutes. B. 10 minutes, always. C. 1 minute for all loads. D. Time is not specified. Answer: A. As labeled by manufacturer, commonly 4 minutes. Which transport method provides the best protection for items after IUSS? A. Uncovered open pan. B. Paper plastic pouch. C. Sealed rigid container system approved for IUSS. D. Cloth wrap only. Answer: C. Sealed rigid container system approved for IUSS. Items sterilized by IUSS must be A. Stored until the next day. B. Used immediately after cycle completion. C. Vacuum packed for later use. D. Sent to sterile storage for 48 hours. Answer: B. Used immediately after cycle completion. Which location is not appropriate for point-of-use decontamination steps? A. Dedicated decontamination area. B. Area designed to clean instruments. C. Scrub sink or hand washing sink. D. Space with PP and proper drains. Answer: C. Scrub sink or hand washing sink. Appropriate PP for handling contaminated devices during point-of-use decontamination includes A. Gloves only. B. Hair covering, eye protection, mask, fluid impervious gown/jumpsuit, gloves, shoe covers. C. Lab coat and glasses only. D. Mask only. Answer: B. Hair covering, eye protection, mask, fluid impervious gown/jumpsuit, gloves, shoe covers. Which monitoring is required each day a dynamic air removal sterilizer is in use? A. YO residual test. B. No testing is needed daily. C. Weekly mechanical check only. D. Dynamic air removal, e.g., Bowie-Dick, test. Answer: D. Dynamic air removal, e.g., Bowie-Dick, test. CMS requires which monitoring for IUSS cycles? A. Physical and chemical monitors each cycle, biological at least weekly. B. Biological only once per month. C. Physical only if heat-sensitive items are used. D. No monitors if the need is urgent. Answer: A. Physical and chemical monitors each cycle, biological at least weekly. IUSS should not be used in which situation, except documented emergency? A. Mixed loads. B. Non-porous instruments. C. Implants. D. Lensed instruments. Answer: C. Implants. IUSS is not acceptable for instruments used on suspected prion disease, CJD, cases because A. Prion requires special reprocessing beyond standard steam cycles. B. Steam at 270 degrees Fahrenheit destroys prion completely. C. Prion only contaminate packaging, not instruments. D. Prion are removed by quick rinsing. Answer: A. Prion require special reprocessing beyond standard steam cycles. AORN guidance emphasizes that devices undergoing IUSS must A. Skip decontamination due to urgency. B. Follow the same decontamination standards as wrapped methods. C. Be dried at room temperature only. D. Be processed without IF use. Answer B. Follow the same decontamination standards as wrapped methods. Which record element is required for IUSS traceability? A. Patient identification and reason for IUSS. B. Staff lunch breaks. C. Ambient or temperature. D. Number of people in the room. Answer A. Patient identification and reason for IUSS. Which best describes proper transfer to the sterile field after IUSS? A. Hand-carried uncovered to save time. B. Aseptic transfer to avoid recontamination. C. Wrapped again in the ore. D. Placed on a non-sterile cart briefly. Answer B. Aseptic transfer to avoid recontamination. Which statement about manufacturer's instructions for use, IFU, and IUSS is correct? A. IFUs are optional in urgent cases. B. Any item can be IUSS processed regardless of IFU. C. IFUs must specify the item can undergo IUSS and define cycle parameters. D. Only temperature needs to match IFU. Answer C. IFUs must specify the item can undergo IUSS and define cycle parameters.